This segment today with Dr. Shaila is going to be about breast cancer awareness. So I have a few questions that I want to ask her, and she's going to give us insight on that. So my first question is, what is breast cancer?
Well, generally speaking, breast cancer happens when there's mutations of the breast tissue's DNA, and those mutations together cause an overgrowth of the breast tissue itself. So there's no checks and balance to the cells, and they just continue to grow, and that's how the cancer spreads.
Okay. And who is at risk for breast cancer?
Well, generally, both men and women are at risk for breast cancer. Obviously, women do develop breast cancer at a much faster rate than men do, but anybody who has the breast tissue can develop breast cancer. Then, of course, if there is breast cancer in your family, you're going to be at a higher risk for it. Smoking, believe it or not, is a huge risk for breast cancer, and being overweight, obesity, having a poor lifestyle is definitely a risk for breast cancer.
What are some cancer signs we should look out for?
Well, first off, I would like to just say that it's important to do self breast exams every month. Even though that's not as accurate as accurate as a mammogram for detecting breast cancer, it's still something good for you to do, because if you don't know you're normal, how do you know what's abnormal?
Yeah.
So, but anyway, some of the things that you'd be looking for is a lump, a hard lump. Persistent pain, so not pain that comes and goes, but pain that's in a specific spot all the time. Skin changes. Sometimes you can have dimpling in the skin, or if the skin develops a rash that looks like a peeled orange. Those are some of the signs that you'd be looking for. And none of that is normal. Even if you have nipple discharge as well, that's definitely not normal. So if you have any of those signs, you definitely need to go get it checked out.
So, what if you have had a child recently? Like, is it possible to confuse nipple discharge with breast
It
milk?
is, the discharge from having a baby. I mean, because there are people who are pregnant with breast cancer. So I guess either way, if it looks different to you, if it doesn't look like it's the milk or the colostrum that you're supposed to have when you're having, after you have a baby, you should get it checked out.
Okay. Some people have asked, what if they have pain around their menstrual cycle?
Right, that's actually normal. You can definitely have breast tenderness around the time of your cycle, and that's hormonally driven, and it happens every month, and it comes and it goes, right? The pain I'm talking about is persistent. Like, it could be right here on the side of your breast, and it's always there. No matter what you do, the pain is there. You could take Motrin and the pain is still there.
Right.
So that's an obvious warning sign.
Okay. Is it normal to feel many tiny cysts in your breast?
Actually, it is. When you do feel your breast, the breast tissue itself does feel like little tiny cysts, and it's also normal to have cysts form in the breast, especially if you're under the age of 40. That's typically what the breast tissue feels like. When we're older, the breast tissue starts to shrink or atrophy, and it's easier to detect breast cancers or lumps with that. So, in either way, it's always important to know what your normal is. I do know some people who have cystic breasts, and they just know that, and then some people don't. So it's just very important to be able to know what your body looks like, and then when to go seek help if it's something out of the norm.
Yeah, because I know I've had cysts before, and
Yeah.
I thought, like, oh my God, am I dying? And then, no, you're not dying.
No.
Okay, so can you tell us how to do the breast exam? How do we do that?
So I wish I had a breast model, but I don't. Maybe at a later date we can post a picture of what the breast tissue looks like, but I know a lot of you probably don't even know that the breast tissue extends up to the collarbone, to your breastbone, and up into this area. So you want to be checking this whole area out, okay? So the first thing that you're going to do, and I like to break it down into 5 easy steps. So the first thing you're going to do is, with your bra off in the mirror, just look at yourself. Look at your breast, see what it looks like and everything. And then once you notice, okay, this looks like this looks like that, okay, then you're going to put your arms up over your head and do the same thing. Okay, and right here, you're going to be looking for some of those skin changes. If there is a lump or something underneath the skin, your skin is going to kind of get stuck, so it's not going to be smooth. It's going to be like an area dip and then down, or you might see some other like dimpling inside your breast. Now, if you see like your stretch marks and things like that. That's normal.
Right.
I'm not talking about that. I'm talking about obvious skin changes. Then the next thing you're going to do is while you're lying on your back, you're going to put one hand over your head and use the opposite arm. And some people say go in a circular motion, but I like to do vertical. And so you're going to start all the way up here and sort of just walk your fingers down, millimeter by millimeter, all the way down. And then you come over and go back up. And you do this all the way over to your breastbone here. Then I like to go in a circular motion around the areola, all the way around, same sort of walking step. And then when you get to your nipple, you squeeze it to see if there's any discharge that comes out. And then you're going to do that to the other breast. Then you're going to do it sitting up because, you know, the body is three-dimensional. It's not just in one playing field.
Right.
So when you're laying down, you might be able to appreciate something, or it may not. As to when you sit up or stand, it might become more obvious then.
Right.
So that is the whole thing, and you repeat it over again. And like I said, any of the above changes that we mentioned before, you're definitely going to want to get those checked out. And of course, the guidelines still stand. Any woman 40 years and older should have a mammogram every year. If you have breast cancer in your family, or if you have those breast cancer genes, BRCA1 and 2, you're definitely going to be needing to get mammograms earlier, probably as early as 30, or possibly before that. I know myself, I had some cystic changes in my breast, and I had a mammogram and an ultrasound and biopsy. Everything was fine, but still, you know, it's just important to recognize when things are abnormal and then go check it out.
Well, that's all I had, and thank you, Dr. Shaila, for coming on the show. Hi, my name is Luisa. I came to chime in with Elle about Breast Cancer Awareness Month. I'm going to give you a short synopsis of what I went through with my mother, who had stage 3 breast cancer about 7 years ago. When she originally found out, of course, she was just depressed, shocked, like, why, Lord, why did this have to happen to me? But she took the necessary steps and measures to make sure that she would get herself back on a healthy track. She went to chemo and radiation, and it was very hard to see all of her hair come out and see her just rub her hair, and her hair would just fall out. And for her to be depressed and knowing that you can't do anything to help her, or you can't do anything to kind of make her happy or make her hair grow, something that, you know, makes her feel beautiful, you can't do it because of the treatment and the process and the toll it takes on the body. The only thing you could do is be supportive mentally, and that's what my siblings and myself did. And after the treatment, then she had a mastectomy because the cancer had spread to the lymph nodes under her arm. Like I said, it was stage 3 breast cancer. After everything was said and done, they told her she would not make it to live past 5 years, even after the surgery and after the chemo and radiation. And by the grace of God, she's still standing. So just long as you're aware of the situation and you take the necessary steps to, get that help to kind of cure it, or, just get it underway, I guess I would say, then I think you're headed in the right direction. Just don't think that it can't happen to you, because it can happen to anybody, because she was the first woman in my entire family to ever have breast cancer, and it's not genetic in our family, it doesn't run in our family. And even though it wasn't a gene that she carries, they still want us to get checked out at 25. But I just say, be aware.